Although having a child can be extremely fulfilling, a post-pregnancy body can make some women feel self-conscious. But feeling confident is possible. Many new mothers are having mommy makeovers to counter the physical effects that are not reversible through lifestyle changes alone, such as healthy eating and exercise. The surgeons at Plastic Surgery of the Carolinas are committed to addressing all of your cosmetic concerns to getting you feeling as confident as you were in your pre-pregnancy body. With me today to answer all of your questions is Dr. Ram Kalis from Plastic Surgery of the Carolinas. Ram, thank you so much for being here.
Thank you, Emily.
First of all, what is a mommy makeover?
So, it means different things for different patients. It largely depends on what's bothering the patient. But, moms sometimes can be a little bit disappointed with changes that are inevitable after pregnancy in terms of the tummy stretching out or the breasts dropping or deflating a little bit. And usually one talks about breasts and tummy as the main part. But there are also issues like labiaplasty, and we can talk about that a little bit more. And a lot of our viewers are going to know probably to what extent, the issues that we're raising might be relevant in their own particular story. And I don't want to forget the face because, young moms who might be up at night can be quite tired, and sleepless nights can affect the eyes, for example. If one isn't finding the time, as you mentioned in your intro, to proper eating and exercise, one might feel like they're either gaining a little bit of weight or just not feeling, maybe looking a little tired or haggard. And so we really address the whole patient, and that's what we try to do. But when we're specifically talking about moms, I think that moms have specific issues that maybe others don't have because of their busy lifestyles and their focus and energy that is devoted almost 100% to kids.
And this is something that you see a lot. There's a lot of demand for this. What do you think has led to the increased popularity?
Well, I think awareness is the most important thing, and I think it is good that, psychologists talk about not having binary concepts. It's either me or him or me or them. I think one can have both, and I think finding that balance between knowing that you're not ignoring or neglecting your child by virtue of worrying about yourself. And I think moms are probably going to be better moms if they feel good about themselves because they feel that much more confident and secure and can deliver all of them to the kids and to the energy of their children. But if they're down in the dumps, they're not going to be able to serve the role of moms nearly as well.
And you mentioned a lot of the different things you could do before. Are these mommy makeovers tailored to an individual's needs?
Absolutely. Some patients are going to feel as though they're mostly focused on their breasts. Some will be tummy, some will be both. And I think depending on the individual patient, the duration of surgery in one particular operation is going to be very patient dependent. Sometimes there'll be multiple needs, and we're going to recommend that we split it out into two because one very long anesthesia can be associated, and a long operation can be associated with a greater risk of complications. So we take each case on a case-by-case basis and judge what is best for the patient, and we also factor in lifestyle. For example, if a young mom has two very young children who are going to need mom's attention, that might not be the optimal timing for surgery unless there's really good help at home from spouse, grandparents, hired help, whatever.
What would you say to moms out there, new moms? What would you say to them about why this could be a good fit for them?
Well, I think that they can answer that question probably best for themselves. If the post-pregnancy changes are not distressing particularly, and they feel like they can carry on their lifestyle with a lot of happiness and satisfaction about the way their family has changed, but they're feeling good about themselves, then they don't need to consult with us. It's the patient who feels like she was really happy with either the size or shape of her breasts, and now after nursing 1 or 2 or 3 children, the breast size might have diminished, there might be some more sagging or drooping. The tummy doesn't quite fit into that bikini like it did before because there's either stretch marks or just loose skin. Sometimes in tight jeans, there's going to be this sort of bulging that comes out of the jeans. These are all issues that could potentially be addressed, and like I said, on an individual basis.
Definitely. And how can people get in touch with you guys to learn more about this?
Well, we have a pretty robust website with lots of before and after pictures, and they can call our telephone number. It's on the website, and if they just Google either my name or Plastic Surgery the Carolinas, they should be able to find us pretty quickly.
Let me see, Doctor. Thank you so much for being here.
Thank you, Emily.